Good morning everyone. Shraddha Vasnik here. In today's lecture we are going to study about the adrenergic drugs, which are also known as sympathomimetics and adrenomimetics. So these are the drugs or pharmacological agents which when administered mimic the response elicited by sympathetic nerve fiber. The adrenergic receptors are present in the beta 1 receptor present in heart, alpha receptor present in peripheral blood vessels, beta 2 receptor present in deep skeleton blood vessel, beta 2 receptor also present in bronchi, and alpha receptor present in eye. These are the adrenergic receptor. Then classification of adrenergic drug. The adrenergic drugs are classified into two groups. First is catecholamines, which contains catechol nucleus, and non-catecholamines, which does not contain any catechol nucleus. The example of catechol nucleus are first is adrenaline and second is noradrenaline. The example of non-catecholamines nucleus are first is ephedrine and second is amphetamine. Then mechanism of action of adrenaline. On heart, when adrenaline combines with beta 1 receptor of heart, it increases CAR, means it increases conductivity, contractility, automaticity and rhythmicity of heart. It causes increase in the blood pressure known as hypertension and increase in heart rate known as tachycardia. When adrenaline is instilled into the eye. When adrenaline is instilled into the eye, it combines with the alpha receptor of the eye. It produces dilation of pupil of eye, which causes increase in the tension on the lens. The net result is in increase in the size of the pupil of eye, which is known as mydriasis. Due to mydriasis, focal length also increases. The person can see the object which are far away but unable to see the object which are nearer to him, and this condition is known as cycloplegia. Just because of mydriasis and cycloplegia, person fails to respond to bright light, which means unable to constrict the pupil of eye, and this condition is known as photophobia. The action of adrenaline on blood vessels and blood pressure. On blood vessels and blood pressure, first is low doses of adrenaline and second is high doses of adrenaline. In low doses of adrenaline, it stimulates the alpha receptor of blood vessels, which produces the constriction of peripheral blood vessels known as vasoconstriction. It causes increase in resistance, increase in output and increase in systolic blood pressure. Then in high doses of adrenaline, it stimulates both alpha peripheral blood vessels and beta 2 deep skeletal blood vessels. As it stimulates alpha receptor peripheral blood vessels, it produces the vasoconstriction, which means it increases the resistance, increases output and increase in systolic blood vessels, blood pressure. As it stimulates the beta 2 receptor of smooth blood vessels, it produces vasodilation, that means it produces decrease in resistance, decrease in output and decrease in diastolic blood pressure. These blood pressure response in moderate doses of adrenaline is known as biphasic response of adrenaline. Then Serdell, working on this response, postulated if the ergot extract is administered prior to adrenaline's high dose, it produces or it causes biphasic response, which converted into the depressor response. The ergot extract blocks the alpha receptor response and produces only beta 2 action, and this phenomena is known as Dale's reversal phenomena. On bronchi, adrenaline when administered, it combines with the beta 2 receptor of bronchi and produces dilation of bronchi, which is known as bronchodilation. These are the mechanism of action of adrenaline. Then therapeutic uses of adrenaline. Adrenaline, it is used in the treatment of bronchial asthma as it causes the bronchodilation. Adrenaline also used in heart block and cardiac arrest. It is also used as a topical hemostatics. It stops the nasal and gum bleeding. It is added in local anesthetic indication, and it is the drug of choice for allergic reaction. Then side effects of adrenaline. If it administered intravenously, it suddenly causes increase in blood pressure, produces fear or anxiety. Hazards of accidental overdose produces cardiac arrhythmia and hypertension. Then these are the some give reasons. First is why adrenaline is not given orally. If the adrenaline give orally, it is rapidly destroyed by digestive enzyme, hence adrenaline is not given orally. Second one, adrenaline is used in the treatment of bronchial asthma. As the adrenaline combines with the receptor present in the bronchi and produces bronchodilation, and in bronchial asthma there is a bronchoconstriction, and adrenaline decreases the mucus secretion and produces bronchodilation. Hence adrenaline is used in the treatment of bronchial asthma. Adrenaline found in the emergency kit of physician. Adrenaline, it is also known as the life-saving drug because it is the drug of choice in anaphylactic shock. It is the drug of choice for bronchial asthma. It is used in heart block and cardiac arrest. It is used as a hemostatic, and it is added in the local anesthetics. Hence adrenaline found in the emergency kit of physician. These are the classification mechanism of action and Dale's vasomotor reversal phenomena and biphasic response of adrenaline, which is also known as the adrenergic drugs, sympathomimetic, adrenomimetics. Thank you so much for being there.